Hi, my name's Alice. I'm one of the front office coordinators at Sparkle Dental. Everyone is stressed occasionally, and when this occurs, it's common to clench or grind your teeth. Occasional clenching or grinding, also known as bruxism, will not cause any long-term damage, but it can become a destructive habit. Bruxism is often unnoticed until it's sufficiently severe to cause various symptoms, including damaged teeth, headaches, and jaw pain. It's worth being aware of the early symptoms of tooth grinding and to seek help early if you think you may have it. The early symptoms and signs include increased sensitivity to hot and cold foods, waking up with a sore, painful jaw, chipped, worn down or shorter looking teeth, waking up with dull headache, earache or chronic facial pain, or your sleeping partner complaining of the noise of your teeth grinding. Early diagnosis and treatment can limit the damage and save your teeth and jaws from more permanent damage. Bruxism is thought to be a learned behaviour, and it is not completely clear why it develops. Until recently, it was often a mystery as to why some people would develop bruxism, but scientific studies are increasingly linking this condition to sleep disturbances such as obstructive sleep apnea or upper airway resistance syndrome. As a result, treatment may involve identifying and resolving any sleep disturbances. These conditions cause changes to the airway while asleep, so it becomes less stable, disturbing normal sleep patterns. When we fall asleep, the muscles in the upper airway relax. The soft tissues begin to collapse inwards and the tongue becomes less tense, falling towards the back of the throat. The lower muscles also relax around your lower jaw, and so it falls backwards. The base of the tongue is attached to the lower jaw, so it further regresses into the back of the throat. One potential reaction to the airway closing up like this is to clench the teeth, as this action holds the lower jaw in position, helping to prevent the airway from becoming so obstructed. As well as being linked to sleep-distorted breathing, bruxism may be linked to the following physical or psychological causes. These include stress, tension and anxiety, suppressed anger or frustration, being overly competitive or hyperactive, malocclusion where the upper and lower teeth don't meet together correctly, a side effect of some psychiatric medications including some antidepressants, and as a side effect of certain nervous system disorders including Parkinson's disease and Huntington's disease. The risk of bruxism can also be increased through smoking tobacco, consuming alcohol or caffeine, or taking certain illicit drugs such as ecstasy or methamphetamine. Recent research has shown that treating sleep apnea can help to lessen the symptoms of bruxism. If you have been diagnosed with bruxism, it could then be worthwhile seeing a sleep specialist to find out whether your airway is restricted during sleep. An overnight sleep study will enable the type of sleep disorder to be identified so the correct treatment can be prescribed. In some cases, treatment with continuous positive airway pressure, or CPAP, can help improve bruxism or completely resolve the issue. Your dentist will examine your mouth for any signs of wear and tear on your teeth. That could include fractured or chipped teeth or dental restorations that have become broken down. They may also examine your jaw joint and muscles and will want to make sure your teeth meet together correctly. Treatment will often involve the use of a guard known as a splint that is constructed out of a hard thermoplastic material and which fits over your upper and lower teeth. There are several different types of splint available to help treat this condition. This helps to prevent your teeth from coming into contact, alleviating the damage to teeth and pressure placed on your jaw joints. Sometimes it's necessary for your dentist to adjust the way your teeth bite together, or they may recommend orthodontic treatment. Your dentist may also need to restore any teeth which have already been damaged with crowns, inlays or onlays to help you chew more effectively. If stress is a factor in your bruxism, take action to reduce your stress levels and avoid the use of stimulants such as coffee, tea and alcohol in the evening. Exercise, meditation or professional counselling can all be useful strategies in reducing your stress levels. If the condition is being caused by certain medications, it might be possible for your doctor to change your prescription or to prescribe a different drug to help counteract your bruxism. If you have any further questions regarding bruxism or sleep disordered breathing, please call one of our friendly front office coordinators on 9300 2622. We'll be happy to assist you. Thanks for watching.